Hi everyone, my name is Nadine and I'm honoured to be able to present this talk on behalf of my PhD student Laura Mitchell. By way of background, I'm a medical psychology researcher and clinician, and my team and I are based at the Heart Centre for Children in Sydney. And together we run 16 unique research projects looking at psychological and neurodevelopmental aspects of childhood heart disease across the lifespan. So some of our studies start from within the womb at the time of fetal diagnosis of congenital heart disease. We followed babies in the early infancy period through childhood, important transitions like transitioning to adolescence and early adulthood, and then adulthood and later adulthood. So I am delighted to be able to present on one of the studies that we're working on at the moment. And I will, in the interests of full disclosure, make sure I let you know that I'd really like to be able to ask you to help us with this study, and so I'm presenting it so that we can generate a conversation about what it might be like to be a part of this work. So From the Heart is an Australian and New Zealand collaboration exploring the health and well-being of children, young people and adults with a Fonatn circulation, as well as their mums and dads and their brothers and sisters. It's an opportunity for you and your family to tell us about your experiences and how we can improve the care and support that's offered for people of all ages with a Fonatn circulation and their families. So in this study, there's lots of opportunity to tell us what life has been like, what your experiences and needs have been, what it's like right now, and your experiences in the present moment, and what you're thinking of and what you have in mind for the future. What's important for us to know in terms of planning ahead and looking at future generations of people with a Fonatn circulation. We're interested in the whole gamut of experiences that come with life, the highs and the lows, the ups and the downs, the goods and the bads, and everything in between. So feelings of loss, fear, anxiety, sadness and depression, confusion, frustration, denial, but also trust, excitement about the future, relief and reassurance, laughter and optimism, love and relationships, and joy and hope. So the reason we decided to do this study and why we think it's important is because first and foremost we know that the experiences of children are often not captured and certainly not captured in their own words and in their own way. And most studies don't tend to take a lifetime approach. So studies will focus on a particular group or age group of people, and they won't include a diversity of ages, of backgrounds, of different experiences, and that's what we're hoping to capture in From the Heart. The reason we think it's very important to include everyone in the family is because we know that there can be so much variation or discrepancy between what a child or a person with a Fonatn thinks and feels, how their mums and dads see them in the world, and how their brothers and sisters experience what it's like to live with a person in the family with heart disease. So because we know there's those differences, and we also know that health professionals often see things wildly differently to the person themselves, we're asking everyone. And we're really interested in teasing out what those differences are and why. We also know that internationally, everyone who works in this field tends to use different types of tools and instruments to look at the things that we're interested in. And what we're trying to do is see which tools work best, what captures experiences in the best way possible to give us the most sensitive, reliable, and valid indicators of experiences and needs. So we're honing in on how we ask the questions, not just asking them. We also know that lots of studies tend to not use instruments that are sensitive to developmental differences. So within the study, while we have a core set of questions. We have 25 different versions of our questionnaire tailored to different developmental stages and ages and different people within the family, so that we're hoping to ask the right questions in the right way to capture the best possible data. We also know for people with a Fonatn circulation, when we think about quality of life and health and well-being, we see really interesting differences between countries. And so focusing on incorporating the experiences and perspectives of every single paediatric and adult congenital heart disease clinic in Australia and New Zealand, we're hoping to be able to create a voice for our community and be able to have that voice represented in the international literature. And I think for me, potentially most important, is that overall we've been able to capture as a community big picture experiences and needs, but not necessarily why we see these. Why some people might be more likely to experience anxiety, why some people might be more likely to experience depression, and what factors contribute most to resilience. And that's what we're really interested in, building models to understand who might be more vulnerable to difficulties along the way. So what does the study involve? Well, the first thing to say is it involves everyone in the family. So the person with the Fonatn, his or her mum and dad, and any brother or sister who would like to take part. We invite people with a Fonatn from the age of 6 years onwards, and any combination of people within the family can participate. So it doesn't have to be everyone in the family, it can be anyone, one person, everyone, or anything in between. And we very cheekily like to say that if you want to do your homework, as Eve has asked us to do, we're the easiest study to be a part of. It is one survey that you can do from anywhere, from home, from work, anywhere you like. The survey asks about your health and well-being, your family, your friendships and supports, what it's like at work or school or both, and in particular the ways you cope during tough times and how you deal with challenges as they come up. It also does something really unique in that we're trying to capture the very often uncounted costs of having a Fonatn circulation. So at the National Roundtable for Childhood Heart Disease on Tuesday, we heard so much about the huge expense that comes with travel, with parking, with accommodation, all of what we think are the little things that actually have a huge impact for families and that fall through the cracks because we never actually ask people to tell us about those costs and to have them be part of a research study. So we are asking specifically about that within this study, trying to better understand and capture not only costs that go through the hospital system that we are well aware of, but the ones that don't, the ones that often lay on the burden of mum and dad. So you can do the survey online or by paper, completely up to you either way, and the online version can be done on computer, tablet, phone. And this is what it looks like. That's the front page. We have a video for our young'uns who are part of the study, so we walk through and explain every part of what it's like to do this survey for children and young people. Very little snapshots of what it looks like. And this is here to show you that despite the fact that we try to make the questionnaire as engaging and user-friendly and warm as we possibly can, there's some really solid science behind the questions that we ask. This is a very well-known model of quality of life and well-being published in the Journal of the American Medical Association. And it shows the many, many different factors that contribute to how we think about well-being in the research that we do, from biological effects of having a condition and having treatment for it, symptom status, functional status, health perceptions. So not only how your body responds, but how you think about how your body is responding. We look at psychological resources, social supports, and practical factors, and a whole range of different things like personality, your values and preferences, the environment in which you live, and the characteristics that make you uniquely you. And we put all of that into a program and really start to be able to build models of what sorts of factors contribute and play a role in the outcomes that we experience. So in terms of how we're going in the study is underway. We started with 952 people who were initially thought to potentially be eligible for the study. We then looked at whether they were enrolled in the Fonatn registry, were at least 6 years of age, had their Fonatn procedure at least 12 months ago, and had ticked the box that said that they were consenting to being approached for research. So from there we had 901 people that met those criteria. And for one person, we didn't have an address. So we had 900 Australian and New Zealand families who were sent a study invitation pack. So far, we have tried over 4,000 times to contact families. That might be by telephone or email, to be in contact with people to make sure they receive their pack, to ask if they have any questions, and if there's any way we can support people to be part of the study. And we've had 501 people enrol. And that's the split in terms of whether people are opting for online or paper-based questionnaires. So 334 online questionnaires have gone out and 167 paper ones. So just to rally a little bit of competition between the states, this is what the participant numbers are looking like. I know Eve tends to be competitive, so I think Victoria has a little way to go to boost numbers. But we're tracking well. We're tracking really well. We've got good representation from all the states and from New Zealand, which is really positive. And one American-based family. And this is a very busy slide with lots of numbers. Essentially, the most important lines are the last two that show the breakdown of those 501 people. But also this is in relation to who has actually returned their questionnaire. So we've sent out 501 questionnaires, but we've only got 254 back. So I guess what's very important to know is if you're not part of the 501, there's still time for us to send you an invitation pack. And if you are part of the 501, there is still time to return your questionnaire. In terms of people with the Fonatn, we have 97 people who have returned their questionnaire, 72 mums, 27 dads, and 58 brothers and sisters. And of the people with the Fonatn and their brothers and sisters, about 60% are under 18. So we are capturing that younger cohort, which is really nice to see. But don't listen to me. I thought I'd share 3 quotes from people who are part of the study. So there are throughout the questionnaire, there are structured questions to answer, but there's also lots of space to share anything that people would like to share with us. This comes from a man with a Fonatn circulation who said, "This is a very interesting study, especially with having the family involved, as I believe it is good to have their opinion discussed in relation to how my condition affected their lives. The questions were thought-provoking and have helped me realise such things as the importance of my partner and that I've had a good life and will continue to have thanks to everyone involved in my cardiac care." So this quote comes from a mother of a girl between the ages of 8 and 11, and she said, "As my child gets older, I'm finding that her condition has impacted other parts of her life, such as school and her behaviour, and I'm very interested in these surveys as they help me understand her needs better." So I love this quote because I think what it really powerfully describes is the idea of contributing to research can also help you to think through things that might be important. And we are always at the just at the end of the phone. If there's anything that comes up in relation to the survey that you want to think through or talk about or ask for help in navigating your way to support, so we can certainly do that. And this last one comes from the mum of a girl in her teens. And she said, "She has become proud of her special heart. Her endurance in sport is poor, but she has now understood it is better to be involved than to win. She's lots of fun for us, and I love her and feel privileged she is my daughter. Thank you for carrying out this study." So what we're hoping is that by having input and contributing to a project like this, we can work together to build better models of care for the future, very much like Karen was presenting earlier. And that's how we want to be able to use this information that you provide us with. So this is just one example of what that might look like. This is our model of integrated psychological care at the Heart Centre for Children. It's a stepped care model with 4 different levels. Level 1 being what we think is the minimum standard of support and resource that all families affected by complex congenital heart disease should receive. Builds in a whole range of different types of supports and resources, and in particular trauma-informed psychological care during hospital admissions. And so much of the evidence that we gather through our research allows us to really fine-tune and better understand the sorts of things that are a part of universal psychological care in this setting. And we move up the pyramid. So this moves up in terms of the level of intensity of support needed and potentially the number of people who might need that support. At level 2, when we think about screening, it's pinpointing what are those factors that might make people more vulnerable to difficulties. And the earlier we know those, and the earlier we're able to identify them within families, the earlier we're able to offer support, and the more likely we are to minimise the impact for children and families. And so we're very passionate about working in at that level 2 and 3 stage. And of course, level 4 is providing more intense care and support as needed at any point in time along the pathway. Okay. So, a reminder to do your homework if you would like to. We would love you to be a part of this study. And we've got some postcards that people can take home on a table outside, and you can, by all means, contact me or my team at any point and we can talk this through with you. Thank you.